So here we go. Format of internal assessment, practical examination, practical marks, 8 book, log book, 10 marks, and record books together 20 marks. 80 plus 20, that is 100 marks for a practical exam. You have to score at least 50 marks in the practical. Now, first 10 spotters will be there. So 10 spotters, in that 10 spotters, general microbiology, one mark, immunology 1 mark, bacteriology 2 marks, virology 1 mark, parasitology 1 mark, uh, mycology 2 marks. Then moving on to the gram stain. Gram stain carries 15 marks, and you should know thoroughly about junction violet, gram iodine, decolorizing agent, acetone, alcohol, and the counter stain with double fuchsin or saffronin, and should be able to tell the examples of gram positive and gram negative organisms. Say in the diagram, write the observation report. No necessity to write. Next, moving on to the ZNST staining, acid or all Albert staining. It's very difficult to maintain the Corynebacterium diphtheria species in the laboratory. We usually give ZNST staining. You should remember the staining of ZNST stain as a CAM, concentrated carbofuchsin, from beneath. Heat it for 5 to 7 minutes, taking care not to char or burn the slide. And long, slender, slightly curved, acid fast bacilli morphology, Mycobacterium tuberculosis you should write. And you should know all the questions that are asked about Mycobacterium tuberculosis, LJ medium, sterilization of LJ medium, 8 weeks it's to rough buff tough colonies, animal inoculation, guinea pigs, everything you should know. For stool examination, you should know all the cysts and ORs, bile-stained eggs, non-bile-stained eggs, entamoeba, stylitica, giardia, lamblia, then ascaris, tinea, hookworm, encrostoma duodenale, entropius vermicularis. Then case scenario, applied exercise, it can be from bacteriology, virology, and mycology. So exercise can be asked. We'll give the history of the patient, we'll give the plate and IMIC reaction, and will ask you what is the probable diagnosis and what are the various biochemical reactions. In fungal culture, we'll give Aspergillus niger, mucor, penicillium, dermatophytes, Candida, Cryptococcus. We'll ask you the describe the morphology of colony. You should know about KOH mount and lactophenol cotton blue mount, and gram stain we do for Candida and Cryptococcus. Negative staining we do for Cryptococcus. Again, with your case scenario, and the last we'll discuss about the various word. And this is about the case scenario. Next is Atcom modules. The Atcom modules demonstrating respect to the patient, attitude, ethics, and communication. Very important. So, how do you talk to the patient? How do you come across the patient and tell the patient what you are going to do? How do you collect the various samples? And how do you, in colloquial language, you advise and take consent and all those things? It's all there. And needle stick injury and very important parcel, and you should advise what all advice you should give. You should not make him panic about telling him about HIV and it's a death sentence. HIV is manageable like hypertension or blood pressure and all this. Good antiviral drugs are there. It should be started within 72 hours. Hepatitis B, if the titer is less than 10 IU per DL, should go for immunoglobulins. Otherwise, okay, you can have one booster dose, and you should get the titer done. HCV should be screened every 6 months. You should be screened, and spillage, how you should manage with them. Sodium hypochlorite solution, what percentage, how to clean all those things you should remember. So this is about practical record books and completely neatly written, and log books will tell you how to maintain a log book in day-to-day clinical practice, and total it is 100 marks. So mark distribution in examination, is similar to that what we taught in general 2 marks. What is 2 marks? Immunology 1 mark, bacteriology 2 marks, virology 1 mark, parasitology 2 marks, and 2 marks. So gram stain 15 marks, ZNST stain 15 marks, and the again X 10 marks, and applied exercise will be a clinical scenario. It can be from bacteriology, virology, or mycology. Apply all the answer 15 marks, and OSPE. The OSPEs are 7 OSPEs. Hand hygiene and wearing of the protection, personal protective equipment, and biomedical waste management, collection of nasopharyngeal swab, collection of peripheral blood, venous blood, and wound swab, sample collection for sputum, urine, stool for culture, and skin scraping for the hair clipping and nail clipping for dermatophytes. These are the things. Then Atcom modules, again, consult how you come across the patient while collecting samples, advise healthcare workers regarding the spill management, and instruct what by how to manage the spill management. And needle stick injury, of course, these are the 3 things. That one is collection of sample, then the needle stick injury, and advising a ward by management of biomedical spill management. These are very important. 5 or 10 marks, it is divided into 4 examiners, 5 marks each. That's 20 marks, and total marks is 20. So these are the various now clinical scenarios. One is HIV, the second one is hepatitis A and B, and measles, chickenpox, dengue, and chikungunya, the viral exanthemata, and dog bite, influenza virus, aqueous simplex virus, papillomavirus, parasitology, amoebic dysentery, and these are all clinical scenarios. Then malaria, intestinal helminths, and the neurocysticercosis filariasis. So these are the various clinical scenarios which I am going to do. So now bacteriology part is one is rheumatic fever, then second one is diarrhea, dysentery, entry fever, wound infection, meningitis, and otitis media, urinary tract infection, pyrexia of unknown origin, Leptospira pusilla, and rickettsia. Okay, mycology, again, various scenario described about dermatophytes, Denia corporis captis. This is in total the practical examination that will be done. You should be prepared for it.